Thanks to Professor J.C. Mohan, my friend. I think it is a very interesting lecture and it's a very new concept of assessing LA function in heart failure. Now, I'll just ask one question to Professor Mohan. Now, considering the busy schedule of yours and considering the busy schedule of the eco lab of your hospital, how far it is important to assess LA function after, I mean, in addition to the global longitudinal strain of LV or ejection, 3D ejection factor?
Right. So thank you, Dr. Carr. The in charge of the echo lab is sitting with me. We do about 40 echoes a day, and each and every patient we do left atrial function, which means left atrial volume and left atrial strain. So it is our routine actually to do left atrial function, the 3 parameters in each and every person. And it adds about 2-3 minutes extra. It's not too much of an effort.
Okay, thanks. Okay, Professor Arup Das বিশ্বাস, any question?
Yeah, thank you, Dr. Mohan. We know that I'm Arup speaking. You know that we know that with aging and with in presence of certain disease like diabetes, hypertension, there is increased left atrial fibrosis. So what can we do clinically to preserve the LA function?
So this is an extremely important thing. I think that the 3 things which we have learned over a period of time is, number 1, we have to have lifestyle modification. 4 things certainly do help in improving the left atrial function, and 4S: salt reduction, sugar reduction, smoking cessation, and sedentary lifestyle needs to be curtailed. That is the simplest way to improve the left atrial function. Of course, many drugs can help us. Controlling blood pressure can help us. Controlling diabetes can help us. We had a discussion on SGLT2 inhibitors. Those could help us. But the 4S is a much better way of describing improvement in left atrial function. And people have done work in this direction, which I had time to actually discuss that issue.
Thank you very much.
Thanks to Professor Mohan. Yes, Dr. Arup, next session, I think.
You can call the next speaker.
Yes. Who is the next speaker? I think Arup, you can call it.
Okay. I think it is Samir. Is Samir there? Samir, I think you all know as an astute echocardiographer, and he is very fond of clinical and echo correlation. He is from Delhi, and he will be speaking on mitral regurgitation, primary or secondary. The clinician needs to know. We all know that in case of heart failure, mitral regurgitation is very common, but whether it started with heart failure or heart failure brought it, or mitral regurgitation was from beforehand, that becomes a question. Yes, Samir, you may proceed.